Welcome. I'm Tony Taylor, and I am the Connector. Thank you for being here. You could have been anywhere else, but you chose to be right here with me. Today, you're in for a great show. I have the band is back together. I have two of my best friends with me. One is Dr. Kevin McDade. He's with Compass Chiropractic. And I have my BFF, Ryan Brown, who's with Vitality Health Massage. It takes a lot to keep this all together. So I rely on these two to keep me fluid, moving, healthy. Welcome to the show, guys.
Thank you for having us.
It's good. We
Yes,
talked
sir.
about this, and now I've manifested it because it took a while because you're busy, he's busy, I'm busy.
Yeah.
So trying to coordinate our schedules has been a doozy, but we're here today.
We finally got it.
We're done. Let's make the best of this.
All right.
So I'm gonna start with Ryan.
Great.
All right. Sounds good.
Ryan, tell me a little bit about yourself. I know you're from Jersey, off the exit, off the Parkway, one of the two. But tell me a little bit about Ryan Brown.
Let's see. Which part do you want to hear about?
So, real quick, just tell me where you grew up, what you did, and then how you got into massage.
Okay. Grew up in South Jersey, a place called Vineland, New Jersey, not too far from Ocean City, New Jersey, and Atlantic City. And came down here in '99 with my wife Erica, and she's
Shout out to Erica. Hey, Erica, how you doing?
And shortly after that, worked in finance and worked for banks for quite some time. And the way that I got into massage therapy was through a broken elbow, actually. So
No way, I didn't even know that.
yeah.
As long as I know.
Little wild hair. Tried skateboarding and was working on the skateboarding with a friend of mine and her son and trying to get him ready for a skateboarding competition, and realized that I was a little too old to be skateboarding at that point.
You never do. I still skateboard.
Yeah, but it came back to physical therapy, believe it or not, and the physical therapist that worked with me was absolutely phenomenal. And in the massage and chiropractic world, there's a term we call supination. So thanks to him, my arm is now able to go back over where I thought I was going to lose that movement permanently.
No way. It was that bad.
Because of the way how the elbow broke. So, but through him, that inspired me. I wanted to do physical therapy. But of course, as life kind of progresses, you have a child and responsibilities and things like that. Kind of wasn't in the card for me to go back to school again for 5 years.
Yeah.
So massage therapy, of course, is poking its head out all over the place. And that was something that interested me. And then my wife's cousin, Stephen, he was a massage therapist in New York City.
Okay.
And he did mobile massage, where he would travel to people's homes and do massage. And once I learned more about that and learned about all the possibilities and all the different things you could do with massage, it kind of ties hands a little bit with physical therapy, all the things that you can do with it. It's not physical therapy, but you can do a lot with it. And there's so many different avenues that you can go. So I went to school, and that's where I met you. And
you
here we are
just
today.
Started school when we met.
Yeah, and I was the crazy one who chose to open up a business right in the heat of COVID. I was like, this is a great time to open up a
Let's
business.
go.
So,
but it worked out, right?
Yeah, we're here.
You're
We're here.
here.
Yeah, and thanks to good people like you and referring everybody, all your tennis folks.
And my salon clients.
We're
here. It's great.
We're here.
So Kevin, same question. Where did you grow up?
Sure.
What did you do?
Sure.
Where did you go to school? And then how did you choose chiropractics?
Yeah, I grew up in Philadelphia, suburb outside of Philadelphia.
Okay. West Philly or East Philly?
It's northeast Philly, but not in the city limits.
Oh, okay.
Suburbs northeast
It's
Philly.
not what Will Smith was.
No.
Oh, okay.
No, although we appreciated the song when it was on, yes. I was there until I did my undergrad at Drexel University. That was in the city, and I lived in the city, which went great. I got done there in 2012, went to South Carolina for chiropractic school. That's 3.5 years.
What part of South Carolina?
Way up northwest in Spartanburg near the
Oh,
mountains.
Spartanburg. Okay.
Never went to the beach. It was the opposite side of the state.
Oh, wow.
And so that took about 3.5 years. And that was just close because the way my undergrad got done is they did quarters. So we got done in mid-June.
Oh, wow.
And chiropractic school started July 2nd. So we had about 10 days to graduate and then go start another
Oh,
thing.
my God.
That was
hectic.
It was rough. Finally got done all that and figured, where are we going to go? Where are we going to move to from here? So we just went up to North Carolina. My wife and I liked we liked the elements of the South, but we missed enough things of the North to go back halfway.
Yeah.
Went to North Carolina. I practiced there for about 3 years.
Where at?
This was in Asheville.
Oh, Asheville.
Right outside
I just got
Asheville.
back.
Yeah, it was actually...
My in-laws live there. My brother-in-law, mother-in-law.
Yeah, we were in Hendersonville, right?
I know Hendersonville.
Right south. Yeah. So we just say Asheville because no one knows where Hendersonville is. And that was fine. We liked to visit there, but living there, after a little while, we're like, okay, we're still just a little too far from family. We don't really like the town that we're in now that we've gotten our roots dug in a little bit. We're going to have kids at some point. Let's just move and figure it out now before we're rooted in too deep. So went to Midlothian in 2018. We left there end of 2018. So I just reached the 7-year point in practice here in Chesterfield in Midlothian. And just recently, 2 months ago, reached my 10-year point of being a chiropractor.
No way.
So it's been fun. But the reason I got into it, it was really by accident. I had no intentions or plans of doing this.
No way.
I wanted to do other stuff in the Navy, and I was a naval ROTC while I was at Drexel.
Okay.
Had all these low back injuries nobody could figure out. I kind of got pushed into the medical model at the time, which I was 19. I didn't care. I was like, just fix it. They sent me to Miami for stem cell injections. I had to do all sorts of different things. And I even went to the ortho at one point. I was like, can you just do a surgery and fix this? I'm so glad that the guy said no, because there was nothing to fix, right? Eventually, I stumbled into a chiropractic office, and in about 20 minutes, this guy more or less fixed the things I was dealing with for about 3 years.
No way.
And by the time that worked for me, and I was like, wow, this is life-changing. This guy had no tools. He just had an old dumpy table in this dark room in Philadelphia.
Oh, wow.
You walk in, you're like, am I going to get killed here? He just body slammed me more or less, and I stood up. I mean, not knowing anything about what's going on, they're like, yeah, just lay down. You're like, okay, sure.
Some creepy old man in a dark room.
And it was amazing. And I got up and I was like, that's the most relief I've had.
No way.
In 3 years of doing all sorts of
Now,
things.
what was the injury from? Or how did that happen?
I'm not really sure. I was hoping in chiropractic school I could figure it out and maybe self-diagnose some things.
Sure.
But it seems like it was some sort of early arthritic condition of just what I call the facet joints in the low back. Those are the joints that when you go to the chiropractor, those are the ones that actually make the popping noise. But it seems like that was deteriorating really early, maybe too much activity too quick. I'm not really sure, but...
Okay.
But the fact...
Did you do sports?
I really didn't. I ran a lot. And I did a lot of exercise, but not organized sports in the way that most people are doing. I actually had no interest in that, to be honest. But supposedly, my conclusion when I look back at everything was like, well, I was probably loading the spine too much. I was running a lot. You had to run in boots and sometimes weight vests and things like that. Yeah. And I got a really small frame, so I think it was just pounding on it for a while. Incidentally, the chiropractor was the only one that made me feel any bit of improvement.
Wow.
And I thought, wow, well, by the time that happened, I was already kind of withdrawing from the RTC program. The way that works is they'll pay for your school if you give them 4 years after. It's a 4-4 trade.
Yeah.
Well, the problem is I got to the end and was like, look, I can't even move and bend it. They had me on medical stuff for 2 years. I couldn't do any of they wouldn't let me do push-ups or run or anything. So by the time I got to see this guy, I was close to graduating.
Yeah.
So this was a very last minute thing. And I think I saw him in December of my senior year, and I had applied and been accepted to chiropractic school in February, enrolled in April, graduated undergrad in June. Wow. So this was all at the last minute.
Yeah.
And loved it. Been in school, loved it. Everything about it. Never looked back since. So it was an accident, but
it was a good accident.
The way these things work out, you go, okay, all right, I'll take that.
Yeah, I mean, and me, I'm metaphysical, so I believe that there's no accidents in life. I think everything happens at the right moment, right time, and it's not a setback, it's a setup. It prepares you for where you need to go and what you need to do.
Yes.
And had you gone to the ROTC or somewhere else, you wouldn't be my best friend.
I wouldn't be my best friend. I'd be real stressed about Iran right now.
All of this info that I have. We don't know what that info is.
No one does.
So, Ryan, because I like to talk about massage because I have been getting massages for years. It helps me. I go see you every month, once a month. Sometimes I'll be like, Ryan, can you squeeze me in? But yeah, let's talk about massage and why it works so well for so many people. Because, you know, again, I hear people complain about their back, about their neck, but they don't go see a chiropractor or a massage therapist. They just take over-the-counter medicines and suffer.
Yeah, that's one of the things that's beautiful about massage is it's a great alternative where you may not have to take those pain medications and have the side effects. And a lot of people are starting to turn a little bit more towards holistic approaches and trying to see about what can we do in the meanwhile without having to go down those roads and preventing surgeries. Yeah. So some of the questions that I ask my clients when they first come in is I give them what I would consider 4 different variations of massage, which I feel every one of them are very important. Yeah. Number 1 would be to come in, as most people would know or consider, quote unquote, luxury massage, which we all know it's more than that. Absolutely. But what they may do is come in for relaxation, which is incredibly important. Sometimes if you looking deep into the world of stress and how much havoc it can just totally spread across your body, and so many different pain issues that stem as a result of that, just to simply shut off for an hour or hopefully 90 minutes. If you come in for 90 minutes, more than likely you're not going to do it. I did 2 hours.
I don't play around. I don't play.
But once you come in and you feel that feeling of just relaxation where you can shut off, you're not thinking about that pain for a while. And some people haven't felt that in a very, very long time. So that's a very powerful thing to do. The second piece would be what I would say more on the therapeutic side, where I have people who come in for something very specific. I have a lot of sports people that play sports, people who have come in from chronic injuries that have been dealing with this for years and are just trying to get through this life. And I'm here to help you get through that piece and hopefully have you leave with less pain. And the thing that's nice about that is your world. When you come to me, you can do exactly what you're looking for. If you're looking for work on your neck, or if it's something where you want to have a little bit more focus, say your lower body, your legs, your knees, foot, whatever it may be, that's perfectly fine. It's your time. We'll work together. That's fine. That's why you'll see on my website, a lot of my massage sessions are based off of time. Yeah. So a lot of people don't care about all the modalities. They don't care if I say fancy words like myofascial release. All they care is, can you get me some help and can I feel better? Exactly. What can you do? I need help. Yeah. And then you have also people who are coming, as I mentioned before, from car accidents. Have folks like Kevin over here who might send me over somebody who's really in a lot of pain, and he discovers that it's muscular. And sometimes that's where he and I work together. That's the beautiful coordination that we have together, where my job is to relax those muscles, keep them calm, and keep them relaxed so it doesn't pull those bones out of place. Yeah. He's here to reset those bones. I can't manipulate like that. Yeah. So we work well together. And sometimes Kevin's really hoping that the client comes shortly after they have the massage because it makes his manipulations, or hopefully I said the word correctly, a little bit easier. Yeah. And vice versa. I saw Kevin,
I went directly to you that afternoon. Like an hour or two later, I was
like for instance with your elbow issue, when he works on your elbow, it makes it a little bit easier for me to do what I need to do. So it works really nice. And then the other part would be, I guess the fourth version would be someone who is very active with her body, someone who plays sports, someone who works out in the gym. A lot of people will work out in the gym. They get their massage after. It's no different than brushing their teeth. Yeah. It's no different than their normal routine. This is just what they do. This is how they get back in the gym with less pain. And I tell a lot of people there's not an athlete in the world that probably doesn't travel around with chiropractor or a massage therapist. You name the athlete, they're definitely going to have one. Both. And that's how they get through. And so I try to treat that. I can't read minds, but my main thing is that I do an intake form, and I hope that they'll let me know what kind of massage or what they're there for. Everybody's different, So that's what we try to do. So that's and managing that pain and being able to use massage more as a tool, rather than, hey, let's go get massages. This will be nice. Let's do this on vacation. Yeah, sure, that's nothing wrong with that, but sometimes people need it a little bit more than usual just to be able to get through this. Yeah.
This winter, we had a crazy winter here, and I fell in the snow, and I didn't think about it. I jumped up, and I first initially thought I had broken my wrist because it was swollen as soon as I got up off the ground, and I was like, oh my God, I can't have another broken body or another setback. And then a couple weeks later, it wouldn't go away, so popped into Compass Chiropractic to see Kevin, Dr. McDade here, and dude, it was like flipping a switch. Like it helped. So I couldn't get relief sitting, standing, and I'm a stylist. So 2 days a week I'm on my feet for 12 hours, like 24 hours in 2 days. So it's also occupational. Or if you're sedentary, sitting at a desk or slumped over, posture is off. So I went to see Kevin and he got me right. So Kevin, let's talk, because your staff is amazing. Like whenever I go to Compass, they even speak, hablas español también. They speak Spanish also. There you go.
Pretty much everyone but me. That's why I need them.
The damn language.
I know.
No, but every time I go in, everybody's so friendly, everybody's so helpful. But what I like about it, it's like you all work as a team. And right now you have a great team.
Yeah.
And I've sent people to you too, and I will continue to send people to you because like it's life-changing to have somebody that knows your body and who's very educated and very driven or also motivated to help you because you're always like so kind and like, all right, what you done, Tony?
That's how it is for a lot of people.
Yes.
I know you're not coming in to say hi. There's something going on. What is it?
For a reason.
Right.
All right. Yeah, exactly. So let's talk about your, because I haven't done that and I don't know if I have a need for it. Let's talk about your laser that you just got.
Yes, we just added that in January. It was in the planning process for a couple of months before that. It's called a class 4 laser, sometimes called cold laser, although they're getting away from that name now because it's warm. Right, it's just compared to the surgical ones of 10,000 degrees, it's cold.
Okay.
But that's been incredible. It's filling in the gaps. You know, over years of doing this, you start to notice when people come in with X, Y, or Z, I notice those people don't get very much relief. Right, so there's holes in the system of if someone comes in with this, I can fix that easy. If someone comes in with this, it's going to be a tough one.
Yeah.
And some of those people, and sometimes it's not bone related. Sometimes it's a ligament sprain or a rotator cuff tear, something that's
horrible.
There's no adjustment. There's no real chiropractic that's going to fix that problem.
Yeah.
Although it might make them feel better in other ways. So we needed something so that no matter what someone comes in with, something in the office is available to help them. Whether it's me or the machine or a decompression table.
Okay.
We just added the laser in January, and it's been fantastic.
Yeah, I remember you guys flew to Texas.
We went to Texas, and that was to research and train on it more before really adding it in.
Okay.
I'm very skeptical about adding new things, only because the reputation of the whole office is on these things. You come in and do this unvetted practice that seems weird and doesn't get you better. That reflects negatively on everybody.
Absolutely.
Yeah.
So we went to Texas in October, mid-October. My friend, who's also a chiropractor, he's got lots of equipment. And he's not like me. He buys it up and gets rid of it if it doesn't work. He's all about it. So I was like, let's go test this out and use it in person. And we also got to just ask a lot of the patients there at that office who were on the machine, tell us about your experience, how it's been feeling.
Wow.
You know, the big thrust of it, and the reason it kind of came onto the market and has grown, is really diabetic neuropathy.
Okay.
It's just that it also treats about 100 other things.
Okay.
So while we might not see that as the primary finding that people need it for, that's kind of what made it popular.
Okay.
Right. So now it could be you've injured a disc, you've torn your rotator cuff, you've got knee cartilage issues. There's other things that just need something other than chiropractic, and maybe even something other than massage. And the way that the laser works is when that laser light gets absorbed through the skin, there's different parts of the body that will absorb it and do something different.
Okay.
Your blood absorbs part. There's things in your cell that absorb it differently to activate the mitochondria.
Okay.
It'll increase protein synthesis. There's so many different aspects of it that essentially we kind of wrap it all up in a nice gift and just explain it to people by saying it increases healing.
Okay.
Turnover rate of the body. If there's damaged tissue of any type, it heals it faster than the normal rate, typically 3 to 4 times faster. So it's been a godsend for us.
Yeah, so how do you know when to use that laser? Or I guess after they come in initially, they see you, they do a diagnosis, or you do a diagnosis, and then you determine whether you can do it with chiropractics or
Sure.
also with the machine.
Sure. I'm noticing a trend where it's a lot of extremity issues that need laser.
Okay.
While the laser can treat, and sometimes we do lumbar spine or cervical spine, which is low back or neck,
Yeah.
it's mostly extremities. I'd say 80% of cases are extremities or neurological conditions that don't. It's a physiology problem in the way that the electricity is being conducted through the nerve. It's not a structure problem I can go in and change with my hands.
Yeah.
So it tends to be a lot of tendonitis, a lot of overuse.
Oh, I need to come see you.
Maybe.
You did.
My elbow.
Yes. Yeah. Yeah.
I even had a few people with foot issues that were not even related to neuropathy. I had someone who was in a car accident and their foot kind of got caught under the brake.
Yeah.
So when the impact occurred, their foot was kind of trapped in there and it just jammed the ankle in. Yeah. So they kind of had this non-specific pain that you couldn't really label as anything.
Sure.
Laser. Better in 3 visits.
Wow.
So it kind of takes a lot of pressure off me if I don't need to know all the answers.
Sure.
I just need to know what helps them because that's all they really care about in the end.
Yeah.
Can I get better?
Now, is the treatment different for everybody? Do they come in for like 1 visit, 2 visit, or is it just on an individual basis?
Yeah, so if it's a new patient, they'll have a custom treatment plan. And my staff gets on my case about it because we have kind of maybe 6 to 8 different templates of really common plans that we use.
Okay.
And it seems like lately everyone's getting a different plan that's not even a template.
Okay.
They're like, this is too customized. They're making it hard for us. I'm like, well, that's just what they need.
But it's what the patient needs.
It's what
right?
the patient needs. I'll see most new patients anywhere from 1 to 3 months is what I'll recommend. Real bad cases I might recommend.
And how often? Like once a week, twice a week, or depends on the severity?
2 or 3. It's rare that if someone has a problem and they're a new patient and it was a problem bad enough to take the time out of their day to come in, it's usually going to need twice a week.
Okay.
There are a few cases where it's once a week or the person's getting better and will reduce their care, but not a lot of people are starting out once a week.
Yeah.
It's very... And I liken this to exercise with people. You want to start exercising? Great. You need to do a few times a week because you're limited by the physiologic response of what your body can do over time.
Yeah.
So sure, you can do once a week, but you're not going to be half as good as twice a week. You're going to be a third as good because you need that extra stimulus.
Now, the $1 million question. Is it covered by insurance? Or does insurance cover any of it? Because
Most of
it can be expensive paying out of pocket. Because I had gone to somebody else before I saw you, and I was paying out of pocket. And it gets costly. And then
Sure.
I think a lot of people are quick to halt their visit.
Sure.
Because it's
Especially in this
hit them
world.
in the pocket.
Everything's expensive now.
Yeah, exactly.
Right? So the short answer is yes, because the majority of insurances do cover chiropractic. They don't all cover decompression. They don't all cover laser. Actually, almost none of them cover laser.
Okay.
But it's rare that someone comes in with some sort of active insurance and we have to tell them you have no benefit.
Okay.
Very rare. At the worst, they're going to have some high deductible where they're still going to have to pay their deductible, but they still get contracted rates through their insurance that are lower than our standard charge.
Okay.
So it's still a savings to them.
Yeah.
It's been a thing lately where I've had people come in and I'll just start out flat asking them when they make these comments. A lot of people think it's going to be several $100s per visit is the perception of people.
Yeah.
And our base rate is $60 on a standard visit. Now, on a new patient, it's different. If you have to do x-rays or an intake exam or something else, that's different. But just I'm coming in, I'm an established patient. I just need to come in. I slept wrong, something hurts.
Yeah.
You might need 2 or 3 sessions. It might cost you $120 or $180 with no coverage at all.
Yeah.
So compared to, I just had an issue. I had to go to patient first the other day. Just to be seen, it was $160.
Gosh.
And then I had to get a prescription. It was like $24. So, it fixed the problem. Great. But I wouldn't want to pay that every time I go in if I'm there maybe 2 or 3 times a month.
Again, it makes people not come back.
Right. It's a barrier. It's a barrier to health.
Exactly.
Sure. So it's a little bit different with everybody. Like there are some insurances that have no coverage, and the only ones that regularly do that are TRICARE, military insurance. The people who probably need it the most. It doesn't make any sense to me. But other than that, people usually have coverage, and if they don't, they've got options to maybe if you want to buy packages, there's a 10% discount or something like that. Or if you want to be on a maintenance plan, you got to come twice a month as a recurring thing. You'll get a discount for that. So there's ways to make it affordable without it I'm going to walk in and I have to spend $4,000 to go there for 5 out of 10 knee pain. It doesn't really work the way I think people are expecting it to in terms of finances.
Yeah.
It's better.
Same question, Ryan. Do you take insurance, or do some of your clients use insurance?
Yeah, I was actually, if you don't mind, if I want to ask one question to you.
Sure.
If you don't mind.
Sure.
With
Wait, this is my show. I answer. I'm just kidding.
With the insurance plans that you have, do the insurance companies work with, like, say, if you set up a plan with them, do they? I would imagine the insurance companies would probably like that more because it shows a little bit more consistency with trying to get yourself well, I guess,
That's true, but the insurance company doesn't really know much about that. They will only find that out if they choose to do a random audit and look at the clinic notes that show the plan that's present.
Okay. Yeah.
They would maybe see if they're looking at, and they're not, because most of the time it's computerized at this point. There's not a person with eyes on it anymore like it used to be.
Yeah.
But they might see, okay, this person has been coming twice a week for 4 weeks based on how the claims are coming into their system. And then they might see the claims just disappear for a while, and that means the person's probably better.
Okay.
But they rarely contact us for any information, but they have the right to say, you're treating this person, it's our insured, what's the plan? Because that is a required part of the documentation process.
Okay. I was curious.
Great
about
question.
That. Yeah. And similar to what he does, we will sometimes do plans and treatment plans as well. So with insurance, it is a new thing there are insurance companies that have worked with actually massage. I actually had a couple solicit for me to become a provider, but it's on its way. There are organizations. I'm a member of American Massage Therapy Association. There's another one called ABMP, American Body Workers and Massage Practitioners, I believe is what it's all for. But they're big businesses that help us to advocate for massage. Yeah. There's things that are called, such as medical massage, where people are working with hospitals. Those things may be covered by insurance. Sometimes, I don't know if massage is covered in the chiropractic world. For a little while, when I did my internship, I worked for a chiropractor, just temporarily, and he had the insurance. The massage along with we would do a little bit of massage before they did the adjustment. So I don't know if that was part of the plan and if that is considered.
It can be. It's a little dicey. Yeah. The rule right now is if the chiropractor hires the massage therapist as a W-2 employee of that office, they can bill massage.
Okay.
Under the insurance health plans.
Yeah. Okay.
If they're an independent contractor renting a room, usually not covered.
A little different.
Some of them might be more friendly where, especially an auto accident case, you get referred and the person has a doctor or medical doctor or even a DPT, PT make the referral. Then sometimes I think auto insurances may cover it as part of a claim as well. Yeah,
and I know sometimes if they are approved through a doctor, there are cases where insurance will cover it. Okay. Another interesting thing too is if you were to travel up in Canada, everything is through insurance. Okay. And everything that even massage related is all covered through insurance. Yeah, we're not there. And it's fascinating how America hasn't. We got a ways to go. So, yeah, we need to catch up. But they're fascinated by our process just as much as we're fascinated by what they do up there. Yeah. They're kind of like the gold standard for massage as far as what we would consider. Yeah. When you go up to Canada, you might want to get a massage. So, but it's interesting, and it's making its way along with. I know this is a little bit off topic, but another big thing that they're trying to push for is where we can go to different states and continue to practice without having to go through the licensing process. So those two things are hot topics that they're working on. So but it's going to be on its way eventually. It'll be here. So cool. It's always adapting. Yeah, but
I was in the salon and my back was killing me, and I had my appointment coming up with you, and let's talk about that because or let's dispel some rumors.
Okay, there's a lot of them.
People think chiropractic is like quacks or like why and I had this client flat out ask me, why would you go see a chiropractor? And I was like, because I've been going for a couple of years now, and it works for me, it helps me, I'm on my feet 12 hours a day. And she gave me this laundry list of excuses why I should not go see a chiropractor. Sure. So let's dispel some of these rumors, because she was like, my sister-in-law had a stroke after she went to the chiropractor. And I was like, I don't think the chiropractor caused her to have a stroke?
Oh, man, this dates back to the 70s.
Yeah.
There's a big lawsuit between the American Medical Association and the Chiropractic Associations that, and you could look it up if any of the listeners want to. It's called Wilkes versus AMA. It was essentially a big marketing program to kind of dispel chiropractors.
Yeah.
And I won't say this is just that fault. There's also a lot of people that have bad chiropractic experiences, and they take that out into the ether and spread that. Although over time it's been more standardized where that's not happening as much anymore.
Yeah.
People are, there's still a lot of differences. You go to chiropractor A, B, and C, they're all a little different, but those differences are, I think, getting smaller with time, which I think is good for the profession.
Yeah.
But it used to be where it was very abstract. Right now it's a lot more structural, right? You could explain it, you could show it on x-rays, people get it more. They didn't have all that knowledge then. They just knew that when they pushed on certain spots, it got you better.
Yeah.
So it kind of was started in more of an energy field. Even the gentleman that's credited with chiropractic from the 1890s was a magnetic healer.
Oh, wow.
It's like, no one really knew what that meant.
No, back then.
It's very abstract. You can't explain that to people other than the results that it was getting. And I think that scares some people. So over time, there's been more and more people as they're graduating school, and some of the older docs that might have practiced more of these abstract things without much of an explanation to the patient.
Yeah.
They're kind of retiring, and the new chiropractors are coming in who I think do a better job explaining the structure of it to make it make sense. But there's also cons of that as well. Like, there's a lot of chiropractors getting away from manual adjustments.
Oh, really?
There are. A lot of people want to standardize it with other machine versions of things
Oh,
to do
really?
Adjustments. But some of the other...
But what are the benefits of that? Or are there benefits?
I don't think there's that many benefits. That's why I personally don't do it.
Yeah.
It seems like we're in a more litigious society now, right? Everyone's afraid of getting sued. If I touch you and do something the wrong way and you get hurt, I'm going to get sued. So we need to standardize it and make it a lighter force, more comfortable experience.
Yep.
But you also get less results.
Yeah.
So you have to balance where you are in that field. But I will say, and it is not a common thing, but it gets brought up 2-3 times a year on my patients, is strokes.
Yeah.
Of all the potential complications with chiropractic, stroke is a possibility, but it's so much lower than people realize it is.
Yeah.
That most of the studies that come out where they just look at spontaneous stroke in a general population, it kind of matches about the chance of stroke from chiropractic.
Yeah.
And the way that those cases typically manifest is it's someone that is a smoker and or overweight or diabetic. There's a lot of comorbidities, which weakens the arterial wall. You have to combine that with maybe a chiropractor that's heavy-handed or over-rotates, or it's got to be this perfect storm of everything goes bad, and then there's a chance.
Yeah.
It's not that it happens, but then there's a chance.
Yeah.
So the fact that the chance isn't zero, we are required to put it in our consent.
Oh, you are.
So when someone comes in, we say, yep, it's estimated to be 1 in 2 million to 1 in 5 million.
Okay.
So it's not zero.
Yeah.
But it's not going to happen.
Yeah.
You know, it's almost like you can say it's not going to happen to you, but it's happened in general.
Yeah.
So unfortunately, if someone does have a bad experience, even if it's maybe they fractured their rib or their uncle went to a chiropractor and hurt their rib, I mean, that's a possibility. It's also rare. Unfortunately, that spreads, right? That's what's popular.
Yeah, yeah.
The 50,000 people who got miracle cures from 3 visits when they should have gotten surgery or were slated for surgery, you don't really hear about that. You just hear the bad ones.
Exactly.
So they're louder.
Absolutely, a lot.
All right, but I'm not going to come on here and say, oh, that never happens. It happens so rarely that it's not even in my mind as I'm treating someone. And then for the people who don't really, who maybe need more of the mathematics of it, if you just compare malpractice rates of the different professions, chiropractors are one of the lowest.
Yeah.
And they're not doing that to be nice. They're doing that because statistically the injuries are so little.
Yeah.
They're just not zero. Wish they were zero, but they're not. There's inherent risk in everything.
Yeah. Now, how was it in school? Like learning the manipulations and all of that. Was it kind of intimidating initially when you first started? Because, A little, but school's long. It's 3.5 years with no summers off, and you don't really get hands-on people to start doing things under supervision until about the halfway point. Oh, really?
So you're pretty far into it. You're like, I've taken 25 anatomy classes. We've spent about 600 hours holding people's heads and doing all these things before you really end up putting a force into a body.
Yeah.
So you're kind of anxious and feel overdue to do it by the time you get to it. But yes, the first time you do it, you're horrible at it.
Yeah.
You don't know how hard to push. You're afraid you're going to hurt them, maybe like some of these other people.
Yeah.
And you start doing it for a while and you're like, oh, you can go 20 times harder than you think you can.
Sure.
And not even be close to hurting somebody. The body's pretty resilient. A lot of it's the angles. To make an adjustment comfortable on someone, it's the angles that you introduce that thrust into the spine. If it's in the neck, it needs a different angle than the mid-back.
Okay.
Than the low back.
Yeah.
And so that's what all the training is.
Okay.
So by the time you do it, you already know where the misalignment is. Maybe you've seen it on x-ray. Maybe you felt it by hand. You're set up for it. You have to pause at that point.
Okay.
Then an instructor comes around and lines up your elbow and arm to look at the angle, and they go, okay, that would probably work. And you do that for months and months and months. Then by the time you finally get to do one, they pair you up with students in your class.
So you're doing each other.
So you're doing each other. And you're terrible at it. So half of chiropractic school is getting a bad adjustment from your colleague and then going in and taking a test with a pounding headache on the next class. But you got to start there, right? You don't want to start on the general public and give them a bad taste of it.
Yeah.
So you start on each other, you get better at it. Then you work in a little bit of an outpatient facility where people are getting highly discounted adjustments and they know you're in training.
Okay.
But you're still doing it under supervision.
And how many hours do you have to have a certain degree of manipulations in that time, or is it just collective?
Yeah, so there's a clinic portion, which I went to school 10 years ago. I think it was something like 1,800 hours or something like that. You have to have, I think when I went, it was 200 outpatient adjustments and 100 student adjustments under your belt, which is not very much.
Yeah.
Now, you get to doing it, I feel like I considered myself decent or good as a chiropractor at about year 5.
Okay.
So there's still a while where
more fluid.
You can do it. Someone comes in with this, you're like, oh, I've seen this 1,000 times. I know that this does work, this doesn't work, and this person probably doesn't have any rotation, so I need to do it this way.
Yeah.
Those types of things come in later. In the beginning, you're like, oh, I know what to do. I'm fresh out of school. I hope this works.
Yeah.
And a lot of times it still does, but you don't have the confidence of doing it.
How is it in Virginia here? Because I know for real estate, I have to renew my license every 2 years, and I have to do continuing education in that time frame. For my cosmetology license, all I have to do is pay a fee once a month, because in Virginia, once a year, because every 2 years. But in Virginia, there's no continuing education for cosmetology.
Okay.
But even though in our salon, we do so much training, and we're a Redken Elite salon. Shout out to Head of Hair. If you're in Midlothian, go see Heather, Yuri, Meredith at A Head of Hair. Oh, comes to me as well.
I've taken my
and then
daughter
go to Compass.
I've taken my daughter there. It's a great place. Yeah, so to answer that, so when you graduate chiropractic school, you have a DC, a Doctor of Chiropractic. That's just your baseline degree, and you can't do anything with that until you get a license.
Okay.
But in order to apply for a license, you have to pass national board exams, which are usually done in school. So you typically get done school having passed the boards and your chiropractic degree. Then you apply for a license, and every state has their own rules on what is and isn't acceptable.
Yeah.
Virginia is on the high end. Virginia requires 60 hours every 2 years.
60.
Yeah, but it's every 2. It's biannual.
30 a year.
So it's 30 a year. A lot of them are 12, 24.
Yeah.
30 is actually on the high end.
Yeah.
And so much of the continuing education now is kind of self-taught, either self-reported or done online. You're watching a video.
Okay.
You have to take a little quiz after.
Well, that's good, though, because I remember back in the day, my friend Michelle Pfeiffer, used to do she was a massage therapist, but she would have to go, I think it was every year, and she would have to do like 20, 30 hours a year. So that's a lot.
It breaks out to 30 a year, although Virginia is nice in the sense that they say you can do all 60 in the 1 year if you want and do none the next.
Yeah, okay.
As long as you get 60 by the 2 year.
And that's how it is in real estate.
Yeah.
Like I can just knock it out, and then when that time comes, it goes right into the bank for the next 2 years.
Right. And they have some restrictions on, it can't just be all business or practice management or equipment, right? It has to be clinical, a certain number have to be clinical hours.
Yeah.
And Virginia does let you do all of them online, which my understanding is some states require only half can be online and half in person.
Yeah.
Which is fine. A lot of people turn those into business trips where you're like, oh, I'm interested in this subject matter, so you can go take some continuing education on it.
Well, I know you always stay in good shape, but how hard is chiropractics on you physically, on your body?
I'd have to say moderate.
Okay.
I'm a pretty small guy. I'm 155 soaking wet.
Jesus.
Right.
Not going
And
weight.
like I said earlier, I've just got a small frame. Chiropractors are notorious when they do get injured, it tends to be either their ribs, their wrist, or their shoulder. Those are kind of
Okay.
the big ones. So that actually was such a problem a while ago that there was a man named Clay Thompson that built something into the tables, and I've used it on you some, where the table piece actually lifts up.
Okay.
And when you press on them, it gives a little bit.
Yeah.
That was actually made for the doctor.
Oh, for real?
Yeah, to save
Not for the patient.
Not for the patient. Although I do.
Thanks, Clay.
Right?
Thanks a lot.
It's comfortable for the patient, and especially if someone's really,
Tight.
really hurting, it's nice because it's a buffer.
Yeah.
The way that it's called a drop mechanism, or what is called Thompson technique because of the man that made it. But that saves some of the force because some people are literally twice my weight.
Yeah,
Sometimes 2.5 times my weight.
exactly.
And so there are limitations in terms of size. I do hear in chiropractic that it's not about strength, it's all about speed, right? It's the speed at which you deliver the adjustment. And the speed does matter, but there's still a baseline level of strength that you need that if you're under that, your life's going to be much harder as a chiropractor and your chance of injury is going to be higher. I've had no shoulder and no wrist injuries. I've had a couple issues on my ribs because there are some adjustments where you are literally contacting them with your body weight in kind of a
Yeah, I
slamming
think you
mechanism.
done that with me, but you always have a pillow.
Yeah, and sometimes I'll put a pillow there. Yeah, there's one where people's arms are crossed and you've got elbows kind of digging into your sternum all the time because you're kind of laying over them briefly. So there's things you can do to mitigate it. Really, a lot of it, though, is I've got a gym routine that's built to make me do this for the next 30 years. I do a lot of dips. I do a lot of pull-ups, a lot of shoulder strengthening,
So a lot
especially
of
in the
upper
front.
body.
Because it really comes down to, they kind of make this joke in physics. Everything's pushes and pulls.
Yeah,
In chiropractic, you're either pushing on them or you're grabbing that bone and pulling it.
yeah,
So a lot of my workouts are pushes and pulls to, one, be strong enough to do it on people larger than me,
Yeah.
or even people that are my size and very stiff. Some people just feel like cement.
yeah,
And so you do have to be careful because you can't go as hard as you want. You can still dislocate a rib or something if you're on the wrong spot or if you just slam on them in the wrong way. So there's a limitation, but you also don't want the limitation to be you. You're too weak of a person to get what you need done.
yeah.
So yeah, I'll work out 4 days a week with things structured to basically save my wrists and shoulders.
Oh,
over
that's
time.
good.
I don't know that every chiropractor does that, but I'm like, I'm in this for the long haul.
Yeah.
It was way too much work to
Yeah.
do, and I had get an injury at year 12 and be in a sling and miss 6 months of work.
Oh gosh.
Type
Now,
of
what
thing.
would you recommend for someone who doesn't necessarily have a problem?
Mm-hmm.
Would you recommend somebody come in to see you to get an adjustment, even though they haven't had a car accident,
Sure.
they don't have a sports injury,
Sure, and
for maintenance?
those are the people that don't need to come in 2 and 3 times a week.
Okay.
To clarify, those are the people that go, oh, this is a tune-up visit. Maybe you've been
Yes.
here before now. Maybe nothing bothers you, but you just felt due for an adjustment. It's
Yeah.
kind of the equivalent of, I always say, like, if you take your car in for an alignment, they have a specialized machine that balances the wheels and everything.
Yeah.
It's rarely going to be just neutral. And
Yeah.
you don't have to go off-roading. You don't have to hit a pothole. Just driving it, just the use in general, requires some maintenance.
Maintenance.
Just like your AC unit or any of these other
Yeah.
mechanical
Great
things that are in
analogy,
use,
yeah.
right? So, sure, maintenance is helpful. You may not feel like a problem got solved.
Yeah.
And I'm not going to say that you're going to feel the benefits that will lead to you not getting arthritis in the future, but
Yeah.
you will feel better. I have so many people that when they finish, they go, I felt good, but now I feel great.
Yeah.
And that difference is as big of a difference as feeling bad to good.
Yeah.
And I think that's one of the myths is I have to have back pain or some
Yeah.
terrible thing
And
to
that's why I
justify
asked,
going
'cause
in.
a lot of people don't necessarily go to see a chiropractor until there's
Sure.
a need or an injury or something going on.
And that's the model of healthcare.
Yeah.
Don't do a lot, wait for a problem, fix it when it
Exactly.
comes up. And the problem is sometimes fixing it's the thing
Exactly.
that's more expensive than preventing it. So
You're so right.
right, so people come in and go, I think it's too expensive, but you're going to have degenerative bone spurs in your neck. You're going to be the 80-year-old man that can barely look left and right. You can't drive anymore, or you need surgery.
Yeah.
Those things aren't cheap. So you will pay for it somewhere in your life.
Yes.
Do you want to pay less now or more later and suffer in the meantime?
Yes.
Unfortunately, those are the options that we're kind of given.
Yes. Yep.
Right, but at the same time, I'm not going to have someone come in and go, oh, well, this is really bad. I need to see you 3 times a week for 8 months.
Yeah.
I do think there are some people guilty of over-treating, and that gives people maybe a little bit of a bad taste. And that's where that old adage comes in. Once you go to the chiropractor, you have to go forever.
That's not true.
Not really. It's about the same as a gym. As much as you want to go to the gym and get in shape and get those benefits, and you're participating in that, you are going to benefit from it.
Yeah.
You don't have to go to the gym, but your health is going to decline in some way, whether measurable or not.
Yeah.
You don't have to go to the chiropractor all the time, but you're going to feel the stiffness. You're going to have less buffer in your body if you get it in a 10-mile-an-hour rear-end car accident. You can't absorb much force anymore. Everything's rigid. So some of it's about keeping mobility. Some of it's about keeping the joints healthy, which again is not always measurable, but I would say it's noticeable.
Sure.
I can't measure prevention of something.
Yeah.
But you can notice, wow, the last 5 times I went on a road trip, I hurt getting out of the car, and now I don't.
Yeah.
Right. So you're measuring the absence of a symptom essentially, which is hard to do.
Absolutely. Yeah.
So it's still useful. It's just useful, I think, to people in a different way. That's less tangible to their life, so they think they don't need it.
Yeah.
Once they need it, then they go, I get it now.
Now, what was the sickest, not the sickest, or the most difficult patient you've had to deal with physically?
It actually wasn't that long ago. Well, difficulty to treat them, or the worst type of shape that they were in?
Both. Start with the worst type that they were in.
Sure. That was just maybe 1.5 years, 2 years ago. This poor guy came in, terrible car accident. Rolled the car and everything. He had multiple disc herniations. He came in on a walker. He was Hispanic, so there was a communication barrier, which is partly why we had staff come in and translate.
Yeah.
He was in a car accident 18 months before he came in to see me. So we were 1.5 years in already. He hadn't worked. He was literally, at the time that he started with me, laying on the couch. When he had to go to the bathroom, his wife brought a bucket to him.
Oh, gosh. It was that bad?
It's too hard to get up and move.
Yeah.
And with multiple disc herniations, the issue is there's a lot of numbness down the legs.
Okay.
He really couldn't feel. A lot of times he couldn't even feel when he had to urinate.
Oh, gosh.
And, I mean, you're talking about 1.5 years. He came in with 2 young kids. He worked in a trade. I forget exactly what it was. But he was the person that was in the worst shape. I mean, he was just not doing well physically to the point that it was affecting him mentally.
Absolutely.
Right.
Especially for 18 months.
And this was a maybe 38, 40-year-old male, something like that. So, stoic.
Yeah.
And you can't provide for your family. And the reason it was 18 months is he had been through other medical models of take these medications. Oh, that didn't work. Go for a surgical consult. Go for injections.
Yeah.
I think he did a couple rounds of PT and might have felt better temporarily.
Sure.
But essentially it came to be that no one was really dealing with the disc issue, which was causing this guy's problem. I mean, he could barely walk. You got to get the feeling back in the legs. Because once you can walk, you're a little more self-sufficient.
Sure.
So he came in, went on a decompression table. I started adjusting him right away. He took about 4 or 5 months, which is longer than most of my patients.
Okay.
But I think it was around month 2, he was coming in without assistance anymore.
Wow.
And it's so funny to see people change, right? Because
right before your eyes.
Right, because we made a little joke. He got so much better, he came in and was speaking English to me one day. Most of the time, his wife or my staff was translating, and I barely ever heard this guy talk. He was just laying there. To the point
that he was in so much pain.
He was in so much pain. He was probably miserable. I would imagine depressed.
I mean, again, you're in a mental fog or just don't feel well.
And he had been to so many other places that didn't work. So I could tell he didn't really want to be in my office. He was dragged in there from his wife because she's like, we can't live like this. So that case went great. I mean, by I think it was about 4 months, 4.5 months, he was back to work. He had full feeling. He was doing everything that he needed to in his life.
That's incredible.
And he was just, I haven't seen him since then.
I was about to say.
As far as I know, he's doing great.
Come back for maintenance.
He's out in the world. Yes, he probably does. Right, because disc injuries are really serious because they don't heal great.
Okay.
It's almost the equivalent of someone that rolls their ankle 5 or 10 times during basketball or soccer. It always rolls after that. It's just not as strong as the original. So he's out there doing his thing. I hope symptom-free. He's more prone to injury, but I also hope that he's like, wow, that chiropractic stuff that I didn't understand or this guy was just jumping on me changed my life. And hopefully that he spreads the word to other people he knows when they have an injury. So that was the worst case I've seen. And that was not that long ago.
Okay.
The hardest cases I've seen are people that maybe have so much degenerative arthritis that the available mobility in their spine at baseline when I see them is close to zero. To the point that you ask them to tilt their head and they can't. They tilt their body.
Oh, gosh.
So it's hard to get in there and actually get movement back and have it still be comfortable for them.
Yeah.
So a lot of times they'll have to start on just do decompression a few visits. I don't even want to get hands on you yet. It's just going to hurt.
Yeah.
So do some of these and a lot of those cases it's a big win if we get 10 degrees of motion. We're not getting you back to normal.
Wow.
Yeah, and you just have to tell them up front, like,
yeah,
maybe this could have been prevented. I don't know what this is wrong.
Possibly.
Right. And I think a lot of people know that. They're not surprised by this. They go, yeah, I've been doing manual labor all my life. I played college football. I've been in 3 motorcycle wrecks, whatever it is. And here I am. I just got through life and it beat me up and it's affected me in this way. And that's the price of it. Sure. And sometimes they're okay with it, which always surprises me as a practitioner, because then it's like, great. If we get a little bit of improvement,
exactly,
you're happy.
Yeah.
Because that's all we're probably going to get. If the bone space is so little. Now, those may be cases where I will actually recommend go to a surgical consult. Yeah. Because I do think there are some surgical cases, but not as many as what people are getting.
And your new laser would that help now? Now that you have that laser, would they be candidates for that?
They would be, in the sense that, and I'll tell people, especially those severe degenerative cases, we'll probably fix your symptoms and the way you feel. You will feel better. Okay. If this is nagging and giving you pain and stiffness in the morning, that will go away. Yeah. But you're still going to be stiff. You're still going to have a limited range of motion. You still might have to turn your body to look behind you to merge. Okay. But you won't hurt. Sure. Which a lot of times is, you're kind of meeting them halfway. That's good enough. That's all they wanted. Yeah. But from a laser standpoint, sure, it'll help that to an extent, but I'm not going to tell them your disc space is going to get big again, and then you're going to get all your motion back. Yeah.
Last question. Expectant moms. Can you work on pregnant women, expectant moms?
Yeah, and even right after delivery, because they also have changes where they're going to be nursing all the time when their head's down.
Or their body, when that baby's going through, it changes the pelvis, it changes a lot of different things. So that's why I was asking, because I would think I would think more women would come for that reason after having a baby, especially natural childbirth.
Yeah, about 6.5 out of 10 patients are female. The female is predominant to male in terms of the
No, practice. I mean coming to you after childbirth.
Oh, sure, yeah.
To realign the hips.
Sure.
To realign their back. Because they've had this pressure and, carrying that baby for 9 months. And their back and their joints.
Yes. And a lot of them start in about the second trimester. And
coming to you.
Yes. And sometimes there's hesitation. But then they realize, wow, this is a really well-researched thing. They even have pregnancy pillows that you come in and lay on. Okay. And a lot of them are just so happy in their third trimester when they're really showing, I can come in this place and lay on my stomach, and it's so comfortable. I can't do that.
You have the bed with the hole in the middle?
Yeah, it's actually multiple pillows that stack together, and you can use one or both of them depending on the thickness that you need. And the concerns are really like, what are we going to do different? Because obviously things are delicate, right? So there are changes that have to be made. Most of them not till second trimester. Okay. I just had someone tell me they're, I think, 5 weeks pregnant. I go, congratulations, that's great. We don't have to do anything about that right now.
Sure.
But yes, especially it becomes, I think, more imperative the later they get in pregnancy and the closer to delivery. It's actually the only cases that I have that I actually increase care with time. Everyone else starts and decreases with care. Yeah. So I'll have them come maybe once a month until like week 30, then twice a month, and then after week 34, maybe twice a week, and then at the end, 2 or 3 times a week once they're past week 38.
Oh, really?
Because it's a double-edged sword. The closer you get to delivery, the hormones in the body, especially one called relaxin, softens the ligaments. It's preparing the side joints and everything to open up for the birth canal to have as much room as possible. Yeah. The problem is ligaments are the things that hold things together. So when we realign you, it's not going to hold very long. Yeah. So that's the double-edged side of it is, yes, you're going to be looser, but that means you also won't hold adjustments very well, which is why you need to do it more. But from a pain standpoint, so many of them, I've even had several come in. They had one child, labor delivery was hard, pregnancy was hard. Then they have the second child under chiropractic care, and they go, the difference is huge. I wish I knew this the first time. Sure. And then a lot of times those are the people that are the mouthpieces to the other expectant mothers of, No, it's actually completely safe. The things you see online where people are body slammed, you don't do that during pregnancy. And people have the same questions about kids.
Yeah.
No, we're not going to rack and crack and body slam them. I mean, kids get totally different adjustments, as do expecting mothers.
Now, are there any concerns with possibly going into labor at that late stage of pregnancy?
No, there's really not. We were taught not to adjust after week 38, not to adjust the thoracic spine, which is the mid-back, basically shoulder blade area, only because that area of the nerve system governs the same nervous part of the nerves that will induce labor.
Okay.
So essentially, this what's called the sympathetic nervous system that starts that process. I don't know of a single case where that's ever happened.
Okay.
Except where people come in and maybe they're running late. Maybe they're at week 41 or 42 and they're like, I need this baby to come out. I do not want to get induced. What can we do? Right. And there's all the things that they're doing at home. Tea, increase of sex, increase of walking, whatever it is. But they also go, is there anything we can do to try to get things moving? And there are, although I've never had someone go into labor in the office. I've had people go into labor the next day.
Oh, that's great.
Yeah. Although at that point I go, that might have happened anyway. I'm not going to say that it's from chiropractic.
Sure.
Although
But
maybe it was.
You don't know.
Maybe it was. Or if they feel it was and they're happy, that's fine.
Because you are pretty good. I have to say. Yeah, I've been seeing you for a while now. You are pretty good.
Oh, every case is different. And eventually you just see them all and you go, okay. Even the rare cases now I've seen hundreds of times.
Yeah.
And I also know what cases come in and I go, look, you need to go somewhere else because I don't know if it's me or what, but I don't have good luck fixing this particular issue. Maybe you need to see Ryan for massage.
Absolutely.
And I've even had cases where I go, you need to see this other chiropractor. They just do it different than I do. And I don't get good results with this condition.
Exactly.
So I'm happy to see.
And that's a professional, right?
Right.
Knowing when to say, knowing your limits and knowing when to refer a client, patient to someone else. Because you know that for you can't get them there. I mean, I do it in a salon. I'll tell clients, I don't do that type of hair. You can go to someone else here, or I can refer you to a friend.
They would rather that than you try and not do a great job.
Do it and screw it up, and then they write a bad review, because, everybody writes a bad review nowadays. But, yeah. Oh, my God, we're running out of time. It's been great talking to you. I could talk all day.
All day.
Gee, wait, don't say it like that.
all day of you.
Dude, thank you so much for coming in.
Thanks for having me on the show.
We've been talking about this for a long time.
We can have a part 2 sometime if
we
you
can
want.
do a part 2.
People have a lot of questions about chiropractic.
So many. And that's why I wanted to do it. I know the benefits that I get from our friend Ryan had to step out. So you can go see Ryan at Vitality Health Massage in Midlothian. You can see Kevin McDade at Compass Chiropractics, and that's also in Midlothian.
Also in Midlothian.
What's your phone number?
Our phone number.
Or how could they get it?
Sure, they can do it a couple different ways.
Right there.
The easiest way is on the website. If you go to our website, it's www.compasschiro, VA for Virginia. I had one in North Carolina, and that's why we had to differentiate the name. CompassChiroVA.com. All over the website are places you can just submit a message. If you have a question, put your name and contact information, hit submit. It gets forwarded to everyone in our office so we can all see it. Somebody will get back to you, even if you're out of state.
Yeah.
People have questions, and if they get those questions answered, they're likely to start care somewhere. Yeah. And that can be life-changing for people.
Completely life-changing.
Right? Completely. Our phone number, if you're local, is 804-499-6020.
Say that again.
499-6020.
804.
804. All in 804.
Dude, thank you so much. I appreciate you. I want to try that laser on my elbow.
It's really, really useful.
I'm for real. Because you remember I had that bike accident, so my elbow is still real tender. And
is it still bad?
Yeah. So we'll talk about that.
Okay.
I'm coming to see you. Okay. I know a good chiropractor.
Yeah, sometimes you have to adjust the elbow. You can make adjustments on the elbow, but most elbow issues are tendon issues.
Tendon.
I mean, if it was just from a fall, maybe
it was from a bicycle accident. Yeah.
Then it may not be, because a lot of tendon issues are injury from overuse.
Okay.
Like that's where they get tennis and golfers.
Yeah, tennis elbow. Well, I'm a stylist, so I'm in a salon, so I use my body. So yeah.
Yeah, but if you fell on it, it may have jarred something out of position. Now everything's operating mechanically, just on the wrong plane.
Well, damn, why didn't we talk about that before? I gotta go.
It's never come up. I could spend an hour with every patient and find a million things, but I always go, what are you here for? What do you want me to focus on? Clue me in a little bit. Oh, man.
Thank you so
fun.
much, Kevin. I appreciate you.
Absolutely. This has been wonderful.
Thank you so much for tuning in. I'm Tony Taylor. I'm the connector. You could have been anywhere, but you chose to be right here with me. And until next time, stay connected. I'm out.